I'm Herages.
And I am Indomitrin.
We are the Progesterone Sisters.
And for our chemical name, we have
our drug classification and their therapeutic is endocrine metabolic agent. Pharmacologic is progestin. Our pregnancy category is B. Animal reproduction have failed to demonstrate any risk to fetus, but there are also no adequate studies or well-controlled studies in pregnant women.
So for the mechanism of action, we bind and activate our nuclear receptor PR, which plays an important part in the signaling of stimuli that maintain the endometrium during its preparation for pregnancy. Our progesterone receptor is a member of the nuclear steroid hormone receptor or SHR family of ligand-dependent transcription factors that is expressed primarily in female reproductive tissue as well as the central nervous system. So as a result of its binding, it's associated steroid hormone, which is progesterone. Our progesterone receptor modulates the expression of genes that regulate the development, differentiation, and proliferation of target tissues 14. In humans, PR is found to be highly expressed in the stromal or connective tissue cells during the secretory phase and during pregnancy. Also, we may prevent pregnancy by changing the consistency of cervical mucus to be unfavorable for sperm penetration and by inhibiting follicle-stimulating hormone, which normally causes ovulation. With perfect use, the first-year failure rate for progestin-only oral contraceptives is approximately 0.5%. The typical failure rate, however, is estimated to be approximately 5%. That's due to late or missed pills action. Let's proceed for the pharmacokinetics. But before that, I must tell you that we can be administered in two ways, that is orally or vaginally. Take note, now for the absorption. If you follow oral administration, micronized version of us is absorbed by the digestive tract. Pharmacokinetic studies conducted in healthy volunteers have shown that after oral administration of 2 100 milligrams capsules, their plasma progesterone levels increased to reach the maximum concentration of 13.8 nanograms per milliliters plus or minus 2.9 nanograms per milliliters in 2 to 4 hours. The elimination half-life observed was 16 to 19 hours. And if you follow vaginal administration, the micronized version of us is absorbed rapidly and achieves stable plasma levels in the range of 4 to 12 nanograms per milliliters, depending on the daily dose with much less inter-subject variation than following oral administration. For the distribution, approximately 96 to 99% of us is bound to serum proteins, primarily to serum albumin, which has 50 to 54%, and transportin, 43 to 48%. Metabolism. If we are administered orally, we are metabolized primarily by the liver, largely to pregnanolones and pregnanolones. Pregnanolones and pregnanolones are conjugated in the liver to glucuronide and sulfate metabolites. Our metabolites, which are excreted in the bile, may be deconjugated and may be further metabolized in the gut via reduction, dehydroxylation, and epimerization. If we are administered vaginally, we avoid first-pass metabolism and achieves higher concentration in endometrial tissue 10 to 12. So for the elimination, we are eliminating the urine 95% in the form of glycuro-conjugated metabolites, mainly 3-alpha, 5-beta pregnanolone, or simply Pregnandiol. Now for the indication, I am indicated for infertility and pregnancy, luteal phase insufficiency, postmenopausal women. So for the infertility and pregnancy, we provide luteal support in luteal phase defects and threatened or recurrent abortion. We prevent preterm delivery. We are indicated for luteal phase insufficiency such as progesterone challenge test in a secondary amenorrhea, dysfunctional uterine bleeding, menstrual irregularities due to dysovulation or anovulation, premenstrual syndrome, fibrocystic mastopathy, dysmenorrhea, menopause. So for postmenopausal women, we aid in prevention of endometrial hyperplasia in postmenopausal women with intact uterus who are receiving estrogen as hormone replacement therapy.
Take note, we are contraindicated in the presence of pelvic inflammatory disease, sexually transmitted disease, or any kind of pelvic surgery because of the effects of progesterones on the vasculature of the uterus. Drospirenone is contraindicated with patient risk for hyperkalemia due to renal disorder, liver disease, adrenal dysfunctions, or any drug that can affect potassium level due to its anti-mineralocorticoid effects and risk for hyperkalemia. We should also be contraindicated in patients with diabetes mellitus, renal dysfunction, asthma, migraine, headaches, and epilepsy because of the potential exacerbation of these conditions. Contraindicated also in patients with thromboembolic disorder or cerebral apoplexy, breast cancer, those with hypersensitive to drugs, severe hepatic disorder, undiagnosed vaginal bleeding, and missed abortion.
So we arrive in the side and adverse effects when taking me. Let's categorize this per body system. So for blood and lymphatic system disorders, be careful for jaundice. So for immune system disorders, you will have side and adverse effects such as anaphylaxis or anaphylactic reaction, angioedema, asthma, erythema multiforme, erythema nodosum, facial edema, hypersensitivity, and urticaria. And for the endocrine disorders, you will likely to have hirsutism, masculinization of female fetus, ovarian hyperstimulation syndrome, and adrenal suppression. So for metabolism and nutrition disorders, there will be changes in appetite, changes in body weight, edema, fluid retention, sodium retention, and hyperglycemia. So for nervous system disorders, it has aggravation of migraine episodes, convulsion, depressed level of consciousness, difficulty walking or gait disturbance, dizziness, headache, loss of consciousness, neuritis, paresthesia, sedition, and vertigo. So for cardiac disorders, there will likely be chest pain, coronary thrombosis, dyspnea, and tachycardia. So for vascular disorders, there will be circulatory collapse, hot flush, hypertension, hypotension, syncope, thromboembolic disorders, thrombophlebitis, transient ischemic attack, venous thromboembolism. So for skin and subcutaneous tissue disorders, we have acne, chloasma or melasma, eczema, hair loss or alopecia, hemorrhagic eruption, pruritus, and rash. So, I will pass it to my sister.
Adverse effect in respiratory, choking, cough, nasopharyngitis, dyspnea, asthma. In gastrointestinal, abdominal discomfort like cramps, pressure, bloating, and pain, acute pancreatitis, diarrhea, constipation, and dysphagia, gastrointestinal disturbance, nausea, swollen tongue, and vomiting. Hepatobiliary disorder like asymptomatic liver dysfunction, cholestasis, cholestatic hepatitis, cholestatic jaundice, gallbladder disorder, hepatic failure, hepatic necrosis, hepatitis, and hepatocellular liver disease. Musculoskeletal and connective tissue disorder, back pain, muscle cramps, arthralgia, and musculoskeletal pain. Renal and urinary disorder, cystitis, dysuria, urinary problems, and urinary tract infections. Pregnancy, puerperium, and perinatal disorder. We can cause spontaneous abortion. We also have an adverse effect in reproductive system and breast disorder, like altered menstrual bleeding, breast discomfort, breast pain, breast tenderness, dysmenorrhea, change in libido, changes in cervical erosion and cervical secretion, dyspareunia, endometrial carcinoma, endometrial hyperplasia, gynecomastia, heavier menses, hypospadias, menstrual disorder, ovarian cyst, perineal pain, premenstrual-like syndrome, reactivation of endometriosis, shortening of menstrual cycle or breakthrough bleeding, spotting, uterine hemorrhage, vaginal discharge, vaginal dryness, vaginal itching, and vaginal mycosis. We also cause congenital, familial, and genetic disorder like cleft lip, cleft palate, congenital heart disease, including ventricular septal disorder or patent ductus arteriosus. We also cause general disorders and administrational side conditions like fatigue, feeling abnormal, feeling drunk, fetal death, fever, irritability, lethargy, malaise, night sweats, pain, and peripheral swelling. Some investigation says that we also cause altered coagulation test, altered lipid test, breast excisional biopsy, decreased glucose tolerance, decreased weight, increased blood glucose level, increased blood pressure, increased liver function tests, and increased weight. We also act as neurosteroid. We protect the brain from damage and promote repair after injury by promoting the growth and repair of myelin sheath that protects the nerve fibers. Hey there, nurses! Before administering us, you need first to obtain a health history, including familial and personal. Also, you need to obtain drug history for possible drug-to-drug interaction and assess any cardiovascular status, including thromboembolic disease, and also conduct teaching so that the client will be aware of adverse effects. Monitor also the laboratory tests to determine the possible reduction of dose and to evaluate toxicity. During administration, you need to monitor vision changes, for we can cause alteration of fluid in the eye and curvature of the cornea. You should also monitor the fluid imbalance because we can also cause fluid retention. You need to provide safety measures and also monitor integumentary effects. Within the duration of treatment, you should ask the client to report any experience of breast lumps, migraine, headache, severe dizziness, or slow or difficult speech, weakness or numbness of arm or leg, and lack of coordination or balance, shortness of breath, fast heartbeat, chest pain, coughing up blood, loss of vision, and hand shaking that cannot be controlled, seizures, and swelling in the face, throat, tongue, and in the mouth. After administration, you need to monitor any adverse effects and also to instruct the client to monitor edema and weight gain. Instruct also the client to report any alteration of vision and to report any itching, excessive hair growth, and hair loss. You also need to instruct client to avoid exposure to UV rays, and it's highly recommended to use sunscreen.
So guys, don't forget, I'm Dimitrin and my sister is Progest, and we are the Progesterone Sisters. Signing off.